Hello and welcome to Nature Source Care. My name is Dr. Fonda Goldman. I'm a naturopathic physician. And today's talk, I was going to cover Abhyanga, the practice of Abhyanga, which is Ayurvedic oil massage. And so I'm going to go through how to do it and also talk about all the benefits as well as considerations if you're thinking about doing it. Note beforehand, the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that persist or worsen, please consult with a qualified medical professional. It's always best to determine the root cause of any disease and to develop a comprehensive treatment plan, of which Abhyanga can be a part. And while natural remedies can be very effective, they may not be appropriate for everyone or as a single therapy, so please keep that in mind. Okay, so why Abhyanga? Why am I doing a video on Abhyanga? Why do I suggest Abhyanga to my patients? Well, what it is, it's a therapy from Ayurveda, which is traditional Indian medicine, and Ayurveda is a paradigm of medicine that's over 5,000 years old. So essentially, what it is sounds simple, but it's actually fairly profound in its effects. Is that usually what you're doing is applying warm oil to the skin, body, to help with balancing both the physiology, if you want to kind of think about it from more of a Western, conventional, modern perspective, or balancing energetics, if you want to think about it from more of an Ayurvedic point of view. So it's about balancing and also rejuvenation of the tissues, physically, but also it also supports the rebalancing and rejuvenation of the mind and the heart and the spirit as well. So, some people might ask, why not just go to a professional massage professional, and get this done? What I found is that I have plenty of patients who I suggest this to who have been to a fair number of massage therapists, and they tell me that somehow, and they don't exactly know why, this is different and it feels much more profound. In fact, like even recently, I had one woman who she's in her 80s and she contracted COVID. And you'll see, we'll get to the list of indications and stuff. And she was having a lot of cognitive issues after COVID, like concentration and memory and stuff like that. And I suggested Abhyanga for her, and she called me the next day after we met, and she had done it, and she said she described it as life changing. So even with her, again, everybody's different, but with her, one session of this Abhyanga really helped clear her mind, and we'll talk about why that might be. I had another patient recently who I usually give Abhyanga to people when we're doing different kinds of cleanses and stuff. And another patient wrote me and she said, this is heavenly. I want to do this every day. So this is, you can, already from that, there's something pretty profound about this. And so even if it seems like, I don't know, a task, sometimes people feel like when I give them things to do, it's like another list of things to do and they're already busy. But they're usually pretty happy about this one. So the other thing to note is that the skin, since we're affecting the skin by applying usually warm oil on the skin, the skin is the largest organ of the body. And so the skin is important for things like protecting all the other organs, regulation, between the inside environment and the outside environment, and also creating equilibrium by containing all the organs and physiology, containing everything else in the body. So the thing is, I already mentioned a little bit, this therapy supports not just the body, balancing and rejuvenating the body, but also the mind and the heart and the spirit. So again, if we're talking about an Ayurvedic perspective, everything in Ayurveda is an energy. And so you can also think of this as energy balancing. And that's why, um, you can get these effects. The other thing, one of my teachers used to say all the time is like the issues are in the tissues. And so sometimes when we don't properly digest experiences, sad experiences or anger or, or frustrations or what have you, if we don't process them properly and move on, a lot of times people will just suppress them. They'll just get busier, right? They'll just dive into work or dive into online media or dive into overeating or dive into something to distract themselves from their feelings, but they're not actually processing their feelings. So the feelings have to go somewhere. So they end up kind of lodging, you kind of think of it as lodging in different organs of the body, and then they're kind of stuck there. And that's part of what keeps people like over time, they'll start feeling like, they're just dragging through life, especially once they get to like middle age. And sometimes they're dragging through life because they've never done any kind of cleanse. And, frankly, our world is not that pristine anymore. Even in good places, water's not that clean, our air's not that clean, the atmosphere is changing, our food system, they're, coming up with more and more information about how much plastic is in our food, plastic particles and things like that. So, we don't really live in a pristine world anymore. Um, and so, all that stuff builds up in the body over time, all the physical stuff, but also all the, mental, emotional stuff builds up over time. And we just feel heavier and heavier from all these things. So, what this therapy does is when you do the warm oil massage, it slowly starts to bring toxins, like physical toxins. In Ayurveda, they call toxins ama. So you might see that word a lot when you read about Abhyanga. But it brings the doshas. So doshas are the three major imbalances with people and with patients, and their symptoms. So in Ayurveda, there are three doshas: Vata, Pitta, and Kapha. And I loosely translate them as Vata is too much wind, and Pitta is too much fire, and Kapha is too much earth. So anyway, if you're a little bit deeper into Ayurveda, I'm not going to go through Vata, Pitta, Kapha and diagnosing yourself or anything like that. Actually, I find a lot of people misdiagnose themselves if they do like an online survey of that kind of thing. But anyway, if you know your dosha, if you know if you're Vata or Pitta, Kapha, or maybe a combination, those are all different energies again, too much wind, too much fire, and too much earth. And so as you start to do this Abhyanga, as you're, moving the toxins, the physical toxins and the energetic toxins from the, out periphery of the body to the center, you're also bringing all these toxins, energetic and physical, back to the gut. So you can think about that. And then once they're back in the gut, you can actually eliminate them through urination or bowel movements or sweating or what have you. The other thing is that this process of Abhyanga supports the seven dhatus. So the dhatus are 7 layers of tissue. And again, this is according to Ayurveda. And the other thing is that as you work the oil, you're starting to, oil up your arm and you're moving down the long bones and going around the joints and that sort of thing. With this warm oil, and you want to take your time with it. A lot of things start to happen there. So when you start to work the oil into your own skin, you're creating like a connection with yourself. Because a lot of people are just, running in overdrive these days, and they actually don't really connect with themselves. So this actually slows people down a little bit, and it, encourages them to do some sort of self-care. And so by reconnecting with self, you're communicating with yourself, you're getting to know your skin and your tissues better. And then through that, there's more kind of awareness, motivation, drive, to stay in balance rather than let oneself get so out of balance. And also, as part of that, like to actually listen to the intelligence of the body, because our bodies have the same, high level of awareness and intuition, the same forces that take the Canada geese. I see the Canada geese. They stop across the street from my house every year when they're going down to Argentina, when they're going back to Canada. And that's amazing to me. There's some sort of internal GPS system that they have, that's natural. That they know how to fly to Argentina. I mean, without a map, right? Without Google, Google Maps or whatever. And the thing is, we're made of the same stuff. We are also nature. And so there's this deep intelligence within us if we only listen. And so this gives us a chance to start listening to that deeper intelligence within ourselves. And that intelligence is also responsible for healing the body. Like if you cut yourself, and assuming, you wash it out just so it doesn't get infected or whatever, and if it's not a gaping wound and you're bleeding all over the place, but if it's just a minor wound and you mostly leave it alone, it'll heal from the inside out. So that's the natural intelligence that the, body has. And actually our minds have that same capability as long as we don't, again, the wound, the mental or emotional wound isn't too, deep. And we've, cleaned it out. so that the mind can heal itself through things like just being quiet rather than being constantly overstimulated by, social media and, just the way our lives are. I mean, most of my patients, you know, don't seem to sit still for, 5 or 10 minutes. Like a lot of them don't cook or even sit down to eat, let alone just relax and tune in. So anyway, so that's a benefit of Abhyanga and part of why we do it. The other thing is that Abhyanga falls under this larger umbrella term called Snehana. And Snehana, translated from Sanskrit, it translates as compassion, and also it's a derivative of a similar word for loving friend. So as you're doing the Abhyanga on yourself, you're developing compassion for yourself, and you're becoming a loving friend to yourself. And as you're doing that, as you're becoming kinder to yourself, that kindness will radiate through you into more of the world, to other people, pets, trees, the sky, the world generally. That'll, if you're into it, that kind of talk and stuff, it'll change your vibration. It'll up level your vibration and bring more healing to others as well. So, and if you compare this, again, a few minutes of this sort of practice with, again, the typical things that I hear in my office when I talk to patients is people are skipping meals, they don't have time to eat, they're eating cold food on the go. It's just like a grab and go lifestyle. They're pushing too much at work. I ask them what they do for fun. Some people have no idea, can't tell me. Um, so you can see how this sort of, it's almost like a sort of like slow food, right? The opposite of fast food. This is kind of like a slow practice, even though it doesn't take that long. Just the nature of this type of practice will slow people down. And that's part of why it's so good for different sorts of disorders with the nervous system and stress and things like that. So, anyway, just a little intro with Abhyanga, but let's get into more of the details and nuts and bolts. So on this slide, I go through benefits and indications. So there are many benefits of Abhyanga, the practice of it. Anti-aging generally. If you stay healthy and balanced, it kind of creates less wear and tear on your mind and body. It's really great for the skin for most things and most people. It makes the skin strong, soft, lustrous. It creates a uniform complexion for people. It also supports healthy hair growth, so making it soft and thick. Um, it improves the tone of the skin and tone of the tissues by increasing circulation. When you increase circulation, moving, the blood and the lymph fluids, you're going to sweep out inflammation, sweep out toxins, and bring in fresh, oxygenated, and nutritious blood to feed tissues. It's a detoxifying practice and it supports proper elimination, so you don't build up toxins just by not eliminating properly. And because of the detoxifying properties and supporting elimination, this Abhyanga is often a part of panchakarma, which is a traditional sort of therapy or detoxifying therapy. So it tends to improve appetite and digestion. It reduces stiffness, fatigue, numbness, and pain in the body. It really calms down the nervous system, senses, and especially Vata dosha. So that's that wind imbalance I was mentioning. It improves mood, increases positive feelings and emotions, which I sort of touched on. It increases ojas. Ojas is a term in Ayurveda. It's hard to translate, but you kind of think of it as this like when we say somebody's glowing, um, it's this kind of fine essence. Sometimes they talk about it like the subtle juice, subtle liquid that's sort of a protective essence within us. And when we work too hard and we don't eat properly and we're not sleeping well and we're just, going, going, going and not replenishing ourselves, that ojas, that protective sort of shiny layer to us, like you can probably see in kids, right? Kids kind of have this natural, I mean, their skin is smooth and all that, but they also tend to like glow a little brighter than adults do. I mean, adults look sort of more gray, for various reasons as they get older. But that ojas, if you're aware of it, And if you're aware of your body, and if you're aware of when you're starting to feel tired and fatigued and you need rest, and you know how to re-energize yourself, then you will maintain ojas, which will maintain your immunity. But also, again, that sort of bouncy, glowy kind of essence, you can't really put your finger on, but you know it when you see it. It's a physical thing, but it's also a mental, emotional thing. When people are, vibing high, that's usually ojas. So again, with increasing ojas through this Abhyanga therapy, you also increase energy and vitality. It decreases stress, it increases relaxation. Through relaxation, it balances hormones and neurotransmitters. Because again, as we're reestablishing equilibrium, all those sorts of hormones and neurotransmitters also get back into balance. It improves sleep. It can improve vision in certain cases, uh, keep somebody balanced. And again, as I mentioned, it creates a better relationship with self. So, specific, more kind of medical indications for why somebody might be interested in Abhyanga: dry, rough, cracked skin, constipation, cracking joints. Those are all those are signs of too much vata or wind. So, it's the qualities of wind from an Ayurvedic perspective are cold, dry, moving, unstable. So when you see cold, dry, rough, moving, unstable symptoms in somebody, you know that their vata is too high. So unfocused, spacing mind, so too much wind in the mind. Most vata disorders, which are mostly nervous system disorders. Older age, because older age, especially after the age of 55, is the vata stage of life when we all dry up, right? We right, our hair dries up, our bones dry up, our skin dries up. Libido for a lot of people dries up. Women go through menopause. That's the vata stage of life. Worry, anxiety, stress. These are all vata type of mental, emotional vibrations or conditions. Vata season, so cold, windy, dry. Where I live in Connecticut, that's fall. Other places might be other things. And some places are vata all the time. So, like if you live in Arizona, it's going to be hot and dry. If you live in Iceland, it's going to be cold and dry, typically. So Vata season or Vata weather, you can do more of this or might need more of this. Emaciation, debility, uh, generally speaking, as long as somebody's not too weak, it can actually help them a bit. Nervousness and restlessness, again, too much wind in the nervous system. Also, weakness and tremors, too much wind in the nervous system. Twitching, paralysis, stroke, too much wind in the nervous system. So, overexertion, so just overworking physically, mentally, that's going to tax your nervous system and bring more wind into it, because just the overactivity is going to generate more vata within. Imbalanced libido, so if somebody's working too hard and not nourishing themselves properly and not resting, the first thing to dry up is libido typically. I mean, even like, fairly young people in their 30s, men and women, are coming to me telling me that they're just too stressed to even really think about, sexual relations with somebody. So, chronic drug use. A lot of drugs really do a number on the nervous system in various ways. And so, you can kind of see with people, you kind of see with a lot of long-term drug users, they start to get, kind of gray and weak and, scatter. You can just, I don't know, I used to work inpatient detox with adolescents and adults and stuff like that. And you kind of just get a vibe. You don't even have to know their story or talk to them. You sort of but not everybody, obviously, but they just again, they've lost their glow typically. They're tired, they're fatigued. A lot of them are very social. That's a major life skill that they have, and part of how they get by for a lot of the time that they're doing, if they're doing a lot of drugs, that sort of thing. But at some point, you can lose so much, to the drug use. Anyway, for a lot of people, chronic drug use will just, put a lot of wear and tear on the nervous system. So people are convalescing from all sorts of diseases. Like I'm getting a lot of long COVID patients now, and a lot of them I'm giving the Abhyanga to, like I mentioned, the woman who's in her 80s, and it's helping them recover faster. or recover at all. Some of my long COVID patients, have been housebound for 6 months and can't leave the house for various reasons. And so I try to, as much as they're able to, start to introduce Abhyanga into their treatment plan, typically to help them recover. Because usually with COVID, especially, it's a wind, vata, pitta type of disease. There's just so much inflammation, and it just burns through the body and the nervous system and the mind and everything, and then it leaves everything dry. Um, yeah. Insomnia is another wind in the nervous system situation. There can be different, again, some of these things, you also have to think about other underlying causes. I mean, Abhyanga is not going to be necessarily a magic bullet, or magic pill or therapy for all of these things. But potentially it can help, in combination with other therapies. So insomnia is usually a vata, too much vata in the nervous system situation. It can balance all three doshas, so vata, pitta, kapha, wind, too much wind, too much fire, too much earth. A lot of arthritis typically involves vata, but that's in the joints instead of the nerves. Nerve pain is usually vata, maybe vata, pitta, and then just general health and balance. So you can see there's a lot of reasons why somebody might be interested in Abhyanga. So, when is not a good time to do Abhyanga? So, these are contraindications of Abhyanga. So, any kind of infected or open lesions on the skin, not a good idea. Any kind of contact dermatitis like poison ivy, if you put oil on your skin, you're going to spread that poison ivy all over. Not a great idea. You're not going to be happy with that. Skin infections like scabies, I wouldn't be putting oil on my skin, and spreading that around either. An active abscess, again, that's kind of infected open lesions, or not infected, but open lesions. If something's draining, you don't want to be putting oil, on an active abscess. Acute infections, when somebody has acute infections, which would also be considered another kind of ama or toxicity, things like when somebody has fever, chills, cold, flu, these are all acute infections or acute increases in ama, from an Ayurvedic perspective. Diarrhea, nausea, vomiting, food poisoning. This is not the time to be doing Abhyanga. Drug, alcohol, toxicity, or hangovers. So if somebody, just, you know, went out for too many drinks and they're still feeling it, you don't want to be doing Abhyanga. Wait for them to get into a more stable state. Acute hypoglycemia, because Abhyanga, the way that it works, it can actually start to rebalance things and clear out the GI, and then it's gonna, the GI is gonna start to move again, and so it might change blood sugar levels. So you gotta be careful there. Not, when you're in a good state, but if you're in in the middle of a hypoglycemic fit or something like that, that's not the time to be doing Abhyanga. But, generally for hypoglycemia, you can do it. Hypoglycemics can do this. They just need to be a little bit careful, and make sure that their blood sugar is stable. Acute jaundice, hepatitis A, liver conditions like that, not a good idea. Tuberculosis, not a good idea. Insulin-dependent diabetes, I already mentioned. Abhyanga can, by clearing the gut, it'll start to, and changing hormone levels, you'll start to be shifting the way you process sugar. Just even, I notice like with myself, often after I do Abhyanga, within 20 or 30 minutes, my stomach's growling and my body's looking for food. So, it does increase the metabolic, they would call it Agni in Ayurveda, which is like a metabolic fire. Just your body's ready to process more because you're eliminating stuff. So it clears out things so new stuff can come in essentially. Very high Agni situations or high inflammation conditions, I would not be doing Abhyanga. Chronic high systemic ama, so chronic high systemic toxins. And usually when somebody is in this state, their tongue will be completely coated. That's one of the ways, tongue diagnosis is one of the ways that we assess, uh, what somebody's dealing with from an Ayurvedic perspective. During chemotherapy, you don't want to be practicing this. Morbid obesity. A lot of people who are obese, again, not only are there, fat cells and fat tissues, distended and stuff like that, but there's a lot of toxicity a lot of fat soluble toxins will be enmeshed in that tissue. And so um, this would not necessarily be the greatest idea for somebody who's morbidly obese. Anybody with moderate to high levels of edema or ascites, all that fluid, may not be a good idea. Anybody with blood clots, bleeding disorders, thrombophlebitis, you don't want to necessarily be doing this because you might move a clot and it would go somewhere you don't want it to go. Um, Moderate to severe indigestion, if somebody's doubled over in pain, this is not the time to be doing Abhyanga. Intestinal obstruction, again, because we're moving things towards the gut, you want the gut to be, and the digestion to be in pretty good shape to keep things moving along. Otherwise, things are going to back up and, cause problems. After any sort of emetic or purgative therapy, because again, you don't want to stress out the body more when the GI's been kind of cleaned out that way. And also, usually after emetics and purgatives, somebody's dehydrated. And then just dehydration and other ways you don't want to do Abhyanga. During menses is not the time to do this. Pregnancy generally is not is contraindicated. During pregnancy, some people can do Abhyanga on the arms, legs, maybe scalp, but definitely not the whole body. Um, Whenever hypertension is induced in pregnancy, that is not the time to do Abhyanga. Anyone who's going through extreme emotions, because again, that's almost like an acute, infection ama situation, except it's emotional instead of physical. That's not really the time. You kind of want them to be, over the hump of that and maybe recovering, but not necessarily in the middle of a meltdown. Anybody who's manic or, just psychologically unstable, it's not the time to do this. Syncope, so anybody who's like passing out, fainting, this is not the time to do this. Acute attack of epilepsy, again, too unstable, not a great time for this. And this may sound kind of funny, but on heavy cloudy days, especially when you have a lot of heavy cloudy days, because the thing is, Abhyanga, it's the reason why it helps to decrease vata, which, as I mentioned, is a wind type energy, cold, dry, moving, unstable, is because oil and applying warm oil is the opposite. So to balance the vata energy, you apply the warm oil. But the thing is, oil generally is heavy and thick and that sort of thing. And so a heavy cloudy day is a heavy, thick day. So it may be that by doing too much Abhyanga, especially when it's a heavy, cloudy day, will actually, you know, um, make you feel kind of fatigued or feel kind of depressed or something like that. So you've got to watch that a bit. You definitely don't want to do Abhyanga right after you've eaten, a full lunch or meal or something like that, because again, you want your gut to be fairly open to be, receiving the stuff that Abhyanga, um, all the toxins and fluids that are being pushed back to the GI. High kapha condition, so this is kind of like high ama. If somebody has a lot of kapha, so again, a lot of earth energy, and earth energy tends to be, heavy and wet, and non-moving, um, then doing too much Abhyanga might increase kapha, and they might get heavier, feel heavier in the mind and the body. So those folks might be more interested, or it might be better for them to do skin brushing instead. And I have a whole video on skin brushing. You can check out if you're interested. And then, as always, you want to check with your doctor for anything else that's not on this list, because I can't put everything on the list. But at least you get an idea of when not to do Bianca. Okay, so about oils. So since this is an oil application therapy, so why are oils, and I started getting into this a little bit, so why is oil important? Like, why not water? You know. So because of the qualities, or again, energetic qualities of oil. So, and different oils have different energetic qualities, but generally speaking, most oils, because they're oily, they will lubricate tissues. And because they're liquid, they will liquefy toxins. Because they're heavy, heavier than water typically, they will nourish and ground. Because they're subtle, typically, They can enter the body at like, subtle cellular levels. Because they're mobile, they can push toxins back to the GI. Because they're soft, they can soften tissue and provide like more balance and tranquility. Because they're slow, they have a calming sedative energy to them. Because they're sticky, they make things cohesive, like tissues, they tone things. And if you warm the oil, that will increase fire in the body, especially metabolic fire, Agni. And if the oil is cold, it'll soothe irritating, inflamed tissues. Okay. So now for the different types, and again, you may not know your type or, and that's fine. When in doubt, you can use sunflower oil. Okay. But if you know your type, these are different oils you can use for your different types. So if you're a Vata predominant person, sunflower, olive oil, sesame, ashwagandha, dashamula, and some of these are kind of herbal oils, not just straight oil, but a dashamula oil, narayan oil, and bala oil. Usually, though, if you're a Vata, you want the oil warmed because Vata people constitutionally are cold because the wind is cold. If you're more of a predominant person, either constitutionally or acutely, then you want cooling oil. So these are cooling oils: sunflower, olive, coconut, neem, safflower, tikta oil. Um, but especially you can use Pitta people unless they're like really highly inflamed. Shouldn't use warmed oil even in like wintertime. But generally, most Pitta people I know can do warm, except during like the hot summer months when it gets hot outside. They may do cool oil then, and even then, oil can be too much for some Pitta people if they're really high Pitta. So if they have too much Pitta, too much inflammation, then they might like maybe skip or do less of the Abhyanga during the summertime. Kapha people, again, they can't do Abhyanga. They wouldn't, it's not great to do Abhyanga for them every day. And I'll get into like how often people should do this. But in terms of oils, sunflower, corn, and flaxseed oil warmed, these are going to be the lighter, more drying type oils that are going to be better for Kapha type people. Yeah. And then I usually suggest for people some of these oils like sunflower, olive oil, sesame oil. I usually suggest people just use the stuff that they get at the grocery store, food grade, because it's going to be cleaner than any sort of cosmetic body care product. Typically, organic, so it's clean, and cold pressed, so you don't have like chemicals used to process the oil. You want this, excuse me. You want the oils to be as clean and pure as possible because you're cleansing with the oil. Um, And as I said, when in doubt, use sunflower oil that's just slightly warm. If you want more information about using oils and body care, I do have a whole body care oils video that's has a lot of the Ayurvedic perspective and other oils besides these. Okay, so let's go through the actual technique now. So what you want to do, you want to get about a third to a half a cup of oil. Everybody's a little bit different, and gently warm it up. Some people use a microwave. Some people do like a double boiler type thing where you put the oil in a cup, some sort of cup like ceramic cup or bowl, and then you put that in like a warm water bath, so that you're not directly heating the oil, but the oil gets warm through the water that's underneath. So you want it to be warm, but clearly you don't want it too hot. You don't want to burn yourself, so just be careful there. And while that's warming up, you can get your bathroom ready. So you get your towels, make sure that there's good, heat. You don't want drafts because again, drafts will increase vata, increase wind. And you can make this like a whole experience. So you can, change the lights or candles, music, make it a whole spa-like experience, whatever floats your boat. And then usually what you want to do is you start at the head and you massage some of the oil into your scalp. If your hair is thin, you may want to skip this step. Not everybody likes oil in their hair. If you don't like oil in your hair, you could just massage your scalp without using oil. But then you would move down. So then you want to oil your face and ears and nose. And what you want to be doing is you want to be moving from the top towards the heart. As you're moving through your body, you always going to want to go from the outside periphery to the center of the body towards the heart. Because behind the heart, there's the lymphatic duct where a lot of the lymphatic fluid drains out. And again, you want everything up and out, up and out. So then, you've done your scalp, you've done your face and ears and nose. Then usually what I'll do is I'll take like a limb, like an arm, I usually do. And then I take the warm oil and I do a first pass over the arm just to cover the arm with some oil. And I go back and get more oil and then I start at the fingertips and I just slowly kind of squeeze and work that oil down the long bone. So I'm working it down my fingers, down my hand, right? Just working that oil in. When it feels a little bit dry, I get more oil. I keep going down the long bones. And then when I get to a joint like the wrist, I go around the wrist. Okay, and each time I'm getting, if it feels like a little bit dry, like the first pass of the oil is getting absorbed by the skin, I go get a little bit more oil. Then I go down the forearm, down the long bones, right, on the top and the sides and the bottom. And then when I get to the elbow, I go around again. And I do the upper arm, go down the long bone on the sides, the top, the bottom, into the armpit or whatever. And then when I get to the shoulder, I start going around. Okay, so again, you want to go from the fingers towards the heart. And you can do the first arm that way, then you can do the other arm, then you can do the legs. So starting at the toes, and again, down the long bones, you get to a joint like the ankle, you go around. Okay, so you go up the legs all the way, the groin, everything, and you get to the abdomen area. And when you get to abdomen area, you want to work in a clockwise motion. Okay, so from the right lower corner up, over, down, because that's the way your GI moves. So you want to just be helping that along. Okay, so again, everything towards the heart, your chest, if you can do your lower back, whatever you can get to, shoulders. You may not be able to do like your upper back, if your shoulders are tight or whatever, that's fine. Do what you can. And again, everything towards the heart. Then you let the oil, penetrate into the skin, as long as you can, like 10 to 20 minutes is ideal. Do what you can. Maybe you could like brush your teeth during this time or do other things in the bathroom at this time. Then what you do is you get into a warm shower. Just make sure you don't slip. So just watch the oil on your feet. I usually don't oil the bottom of my feet because I don't want to slip and fall. But then what you do is you get into the warm shower and you just rinse off the oil with warm water only. You don't want to soap off the oil you just put on your skin. You want it to let it penetrate into your body. Okay. You can use soap though for your hair, the private areas like armpits, groin, that sort of thing. That's perfectly fine. But most of the oil, you just want to thin out a little bit with the warm water. Um, and that's it. Okay. Then afterwards, you get out, you wrap yourself in towels, a robe, warm clothes, get comfy. And I usually suggest people rest for a good 10 to 20 minutes and rehydrate themselves with like water, decaf teas, and things like that. Because you probably have lost some fluid because the fluid has gone up and out and drained out, in that duct behind the heart. So you do want to rehydrate yourself. Um, the thing is, I usually, I talk to people about timing, time of day or even which days to do this. This is usually people feel very relaxed after this therapy. So I typically don't like to do it on the mornings when I go to work because then I don't feel like going to work. I'm pretty relaxed. I'm like, I don't feel like going. Um, but so you might think about when would be the best time to feel relaxed, assuming that's going to be your, reaction to this therapy. So maybe after work, maybe at night before you go to sleep, maybe on slow mornings. That's typically when I do it is like, when I have a slow morning on the weekend where I can just take my time. I don't have to worry about being anywhere at any particular time or being, on, quote unquote, on for somebody, that sort of thing. I can just really get into the therapy and, just give all that time to myself and the therapy. That's usually best. But that's the thing is if you have a lot of anxiety and stuff like that, maybe the Abhyanga every morning will settle your energy and you'll be more productive. So it might work a little differently for different people. So just consider, play with it a little bit, find out what works best for you in terms of when it's going to be best for you to be probably the most relaxed during the day. Um, okay, so I mentioned like how often should you do Abhyanga potentially? Well, Vata people, they're the ones who are helped the most by this therapy. They're typically the people who need the therapy the most, and they could definitely do it every day. Unless they have one of those contraindications going on. But to people, usually they don't need as much, maybe twice a week, maybe less in the summer, as I mentioned, because with the heat and them sweating and stuff like that. Too much hot oil in the summer might aggravate pitta people, especially their skin. Half of people, maybe once every 1 to 2 weeks, they'll need it the least amount because, again, of their constitution. So, how do you know? Like, am I doing it too much or too little, or, what's the right amount for me? Well, here we go. So, if you're doing Abhyanga, at a good rate, so for most people, it's going to be like once or twice a week is pretty good as a maintenance thing. You'll have regular, easy bowel movements. Urination and sweating will be, all good. You'll be eliminating properly because you'll generally be more hydrated through the oil. You'll have normal appetite and thirst. You'll have less stress and pain in your body. Skin will be soft, oily, uniform in complexion. There'll be this lightness about you, in your body and your mind. Your mind will be clearer. Usually people are happy and content. They sleep better. They have pretty good energy levels consistently. And then also their tongue, it's, if there was any coating on their tongue, that usually clears out. If you're not doing Abhyanga enough, but again, I have a list here, but the thing is, there can be various physiological reasons besides not doing Abhyanga enough. But these might be, indications for people who would do better with more Abhyanga. So things like constipation, dry skin, insomnia. Some of these things you remember from the indications list. So ringing in the ears, that's another Vata thing in the um, nervous system. Dizziness, more Vata, stress, emotional disturbance, gas, that's Vata in the GI, excessive thirst, body ache and pains, headache, and burning pain in the liver area. Now, the burning pain in the liver area, this is a long list that I got from, a teacher. Um, I mean, I wouldn't be doing Abhyanga for somebody who has burning pain in the liver anyway. It's on the list. And then what if you're doing too much Abhyanga? That's a possibility. Like maybe you're a kapha person and nobody told you, you shouldn't be doing this every day. Well, again, because the nature of the oil is heaviness, you will tend to feel heavier in the body and in the mind. You might actually get more body aches, more headaches, because it'll be throwing your equilibrium off with too much of this oil, too much of this therapy, rather than bringing it back into balance. Dizziness, excessive salivation, there's just going to be more fluid in you, and that's going to weigh you down. Drowsiness, because again, that heaviness in the mind. You might actually have oil leaking from your GI, like in your stools and that sort of thing. Nausea, vomiting, because there's just too much oil. Maybe your liver, is congested and it's not processing the oil. So it's just going to, float on up into the stomach and make you nauseous or vomit. Fever, because again, it's disturbing equilibrium. Burning pain in the liver area. So again, this burning pain in the liver area might be because you're pushing your liver and gallbladder too hard from too much of this oil therapy. Swolly, puffy eye. So again, just too much. You're going to be too much fluid, whether it's water or most likely oil. You're going to start to, uh, you know, just be filled with it. So again, it's all of it. All of this is about balance. So keep that in mind. So safety and cleanup. So a few extra tips here. Again, getting oil in your feet. I don't do the bottoms of my feet because I don't want to slip and fall. Always be careful walking in and out of a shower. Um, yeah, and just walking around generally if you got oil on your feet. Um, the other thing is oil may accumulate in your drain. So once or twice a month, depending on how much Abhyanga you're doing, to clear some of that out in your drain, you can pour a fourth of a cup of dishwashing detergent into the drain, then pour in 2 to 3 cups of boiling water, let it sit for 15 minutes, and then you can run more hot water through the system for 2 to 3 minutes to help flush out some of that oil that might hold up, depending on what kind of pipes you have. Oil may also accumulate in fabrics. I always use old towels and clothes and stuff like that because some of these oils, like even olive oil, it can kind of stain things a little bit green or yellow. That's just the nature of the oil. But sometimes the towels will get heavy with oils and stuff like that. So you can try to get some of that stuff out of your fabrics by washing them with your regular laundry detergent, and then you can add a cup of rubbing alcohol to the laundry mix or a fourth of a cup of dishwashing detergent because it's a little bit harsher, it kind of breaks things up a little bit more. You could try that to get oils out of your fabrics. Again, I typically just use old stuff, that I know they're not going to be around that much longer. Um, and then you want to keep these oily fabrics away from heat and flame. So you don't want to throw dry, oily fabrics into the dryer. It can be combustible. Store your towels and fabrics in cool, well-ventilated areas. And then don't store, the oily fabrics like in a car trunk or isolated corner or something like that, because you never know when flame or heat might, show up in that area. Okay, so just a few things to consider. And so that is it for Abhyanga. Again, this is a pretty important therapy, at least part of my practice. That's been really helpful for a lot of people. So I hope you found this talk helpful, useful, interesting. Maybe give it a go, see how you feel about it, have your own experience of it, and then decide for yourself. Um, so yeah, I also have another YouTube channel on Vedic astrology if you're interested in that topic. That's out there as well. So as always, you take good care, stay healthy, and until the next one. Namaste.